Hi everyone. Just wanted to provide you some feedback from last week. Couple things. First, just wanted to talk a little bit about the reading material for the week. Chapter 7, we had some details about implementing organizations. I think the review process and implementing. Probably the biggest implementing organization would be CMS. And I know that a couple of you work with an organization that works extensively with them. I've worked in great detail with them over my career, and it would be really cool to work hand in hand with them. I've never done that. I've always kind of been on the other side of the table, but uh, uh, interesting organization, and it's important to have when you are on the provider side or on the contractor side. Slightly different than our friends in the class that are the contractor that works directly with them. I know that we have a couple in the class that work with the contractor that works with CMS developing regulations. Um, I've worked with contractors that have worked with CMS implementing those regulations. So sometimes that can be an interesting situation because you don't always have the same take that they had when they were in development. So sometimes that can be a hard lesson depending on what they had in mind when they were initially being developed. Um, so um, so it's always interesting to learn a bit about what their thoughts were and what the initial take was through the development process. Um, and what's interesting, it's funny, the in the legislative process, the folks that develop the law don't necessarily always have the right background. But keep in mind that the folks that develop regulations, I think we talked about this a little bit last week. Um, so when throughout the legislative process, we develop the law. So that comes through our legislative process. That goes through the House and the Senate. We develop a law like the ACA or like HIPAA, and there's a law. So the law doesn't really mean a whole lot without regulations to back it up in a lot of instances. So an organization or a department like Health and Human Services, and then a sub-department like the Centers for Medicare and Medicaid Services, have to develop regulations to actually support these massive laws because the law has so many smaller pieces. And so these regulations, which in many cases actually become like little mini laws because they themselves go through the Federal Register process to public comment. They are commented upon and then themselves become almost like a little mini law in their own right, because they do need to be followed by those that are required to follow them. um, are, are what we need to pay heed to. So the law may say, hey, you all need to keep information private. HIPAA is a good example. You all need to keep information private, but they don't tell us how we need to do that. So the privacy regulations tell us how we need to do that, or the security regulations, or the breach notification regulations. So those regulations are the important part. So CMS they are the implementing agency, and so we learned a little bit more about that through our reading this week. That's why those implementing agencies are so crucial. In our discussion this week, we talked a little bit about how how we could talk about, or how we could use stakeholders, how stakeholders were important to various different laws, regulations. In this case, we were talking specifically about a community health assessment, but how that community health assessment was then being used to push forward various agendas. And there were a few specific agendas that were probably more popular than others. Wellness was a big one. So wellness from healthy eating, wellness. Specifically, food deserts is a problem. Not having enough specific food resources in certain areas. So both of those things, wellness, as far as not access to appropriate, even I'm trying to think. One person had mentioned that there is information in the report about not having access to recreational activities for families, which is interesting because I would say in Allegheny County there are probably appropriate access. There is probably appropriate access to parks and those types of things, but there wasn't necessarily appropriate access to that. So, so what types of stakeholders are there? And there were several mentioned, but keep in mind when we're talking about stakeholders, we have internal stakeholders, so within the within Allegheny County, but then external stakeholders in Allegheny County, so or even outside of Allegheny County. So stakeholders such as the healthcare entities, stakeholders such as folks outside of the outside of Allegheny County, but maybe that could be helpful. So, other wellness entities that could come in, maybe, like Giant Eagle. If Giant Eagle is, because that's obviously not just within Allegheny County, but maybe if they could come in to help with a food desert issue, or with wellness, if there is a national organization that could come in to help from a stakeholder perspective. Also, various types of interest groups that may be able to help. So all different types of stakeholders that may be helpful from an external and then internal within Allegheny County to help promote these wellness, different types of wellness initiatives. The one that I did want to touch on, and Lisa, not that I'm singling Lisa out, but Lisa was the one that had brought this up, was fatal overdoses. And I had specifically mentioned this, and that I said I would mention it. So in the recording, so I wanted to talk about it, and I didn't get a lot of feedback. So in the discussion, so I did want to mention it here. Fatal overdoses, what's interesting is that it is a huge issue. Opioid abuse is a massive issue. Prescription opioid abuse is now leading to massive problems with heroin abuse. When folks can't get access to prescription opioids, they're transitioning to heroin. Heroin, I'm not sure if it's the same way here, but at least in New York, heroin is significantly cheaper than both prescription opioids on the street as well as a six-pack of craft beer. So it's it's a cheap high. And it's a huge issue. So what is going on up there is that they are giving Narcan and naloxone to be given out to civilians. So naloxone, nasal Narcan, can be administered to someone that has an overdose, and they can be revived. So typically it's administered not necessarily nasally, but intravenous, and it can revive someone that has overdosed on the opioid. But what is happening is they have this nasal version. It was great for police officers, law enforcement officials. They were able to administer it and bring the person back if say the EMS professionals hadn't gotten there yet. Law enforcement was able to administer this more quickly. What's interesting is, at least in our area, they started giving it out to civilians. They started doing training, giving it out to the civilians. I had asked for responses in the discussion board, and perhaps you hadn't seen it. It was just over the weekend. But I had asked for discussion in the discussion board. The reason I asked for it, and I asked for you to contemplate this just for future reference, the reason I asked, the issue that we're seeing now, my husband deals with this every day, unfortunately, both in the ER and on the streets, because he's a street paramedic as well as an ER nurse. But now what they're seeing is that the people are going to get this, those that are actually addicted to these medications are going to get the naloxone, and they are overdosing. They're pushing themselves to the point of overdose, and making sure they have this stuff there so that their friends can bring them back. And we're having a major uptick in these overdoses. So I'm wondering, is it worth the having it there for them as a preventative, because now they're pushing themselves further to the point of overdose because they know they have that right there in their homes. So now they're pushing their drug abuse a little bit further because they know they can revive themselves. But it's an interesting ethical issue. But so something to think about. But there were obviously many other topics discussed. Lots of other stakeholders. There's always many stakeholders, governmental stakeholders, corporate stakeholders to consider. When we're thinking about policies, there are just a multitude of different interest groups. Schools are always a huge issue, especially when we're talking about wellness. Schools are a huge issue involved in any wellness issue. And actually now too, even with this overdose issue, thinking about making sure that we have maybe Narcan not in the elementary school, which is actually where I'm more concerned about wellness in the elementary school, having access to Narcan in the high school environment. Is that a smart idea, important idea to have? So lots of things to think about. But that's about it for now. And we'll see everybody in the discussion boards this week. Thanks so much.